Shall we begin? So welcome colleagues, and welcome to this webinar on systematic reviews. As a result of the COVID-19 pandemic and its impact on the collection of data for postgraduate students during the lockdown, we've certainly had more students asking about systematic reviews. And this may not be familiar territory for many librarians, with the exception of some librarians in the health sciences domain. But as a result of lockdown, we may well be fielding requests from students in the other domains, especially in the social sciences, education, psychology, social development. This is an introductory webinar aimed at those who don't know too much about systematic reviews. Our presenter is Gill Morgan, librarian from the Bongani Mayosi Health Sciences Library at UCT, my colleague. The presentation is actually going to be in 4 sections, with the 3rd section being a live demo. But we do have a backup plan with slides if we hit tech issues. I guess this is living dangerously, doing a live demo on a webinar. Just some housekeeping. Please put your questions and comments in the chat. Everyone will be muted. And then when we get to the last section about the role of the librarian, please use the raise hand function, which is there on the participants list. If you click on the participants list, you'll see that there is a link to raise hand, and we will then get to you. But before I hand over to Gill, we actually have a quick poll that we would like you to participate in. It's about your experiences with systematic reviews, and we'll give you a few seconds to click on it. Is it A, everyone's now asking for them, so I better get up to speed? Is it are you getting a lot of requests? B, I'm interested in them, but not actually having done one, or actually had anyone ask for assistance. C, you've assisted with a few, and D, you're actually very experienced. You've participated in many. So let's just, yes. Oh, Charlene, you there? Thank you. Before I hand over to Gill, I'm going to give Charlene 2 minutes, which will also then give you a chance to do the poll. Okay, Charlene, over to you for 2 minutes.
Okay, thank you so much, Ingrid. Dear colleagues, I sincerely wish all of you are well and your families are safe and well. And a very, very warm welcome to the Systematic Review webinar hosted by Ingrid and her colleagues. She will be facilitating this, so I leave it to her capable hands. So I just wanted to plead with everybody to please renew your LIASA membership. As you know that we need LIASA to be sustainable, and it is our professional body. And I would please encourage, you know, your colleagues and your friends to renew their LIASA membership, as well as to join. I think we are having exciting things happen on HELIG, and I think your LIASA membership fees would be well worth it. I also want to say that I do hope you enjoy the new learnings, enjoy the new experiences, and take as much skill and knowledge as you can. And please engage with the facilitators on these HELIG.
Okay. I'm not sure if Charlene, you've got a technical problem, or maybe not. Okay, so I'm now going to hand over to Gill, who's going to take us through the process. Over to you, Gill.
Thank you. Thank you, Ingrid. Thank you very much. Thanks, Ingrid. And everyone, I'm going to share my screen with you because I need to get to my PowerPoint, so just bear with me a moment, please.
Anna-Marie, would you hit the record button, please?
Thanks, Ingrid. We are recording.
Okay, so indeed, welcome everybody. Nice to see so many of you, and thank you for attending. I'm just going to get to the point in where the contents of this particular webinar. So, indeed, we're going to look at an introduction to systematic reviews and where we are at the moment within what we've been experiencing at UCT libraries, both at the Health Sciences Library and at the at the main library with social sciences and other departments. And it's going to indeed be divided into four sections. So we've got, first of all, there's going to be a brief differences between systematic review and other review types. I'm going to go into the systematic review process and how literature review fits into that, and obviously that is what we're going to be concentrating on. Then the Living Dangerously section, which is the online demonstration of a systematic review literature process search, and I'm going to be concentrating on PubMed for that. And then we're going to have a bit of a discussion. So where we all are with the whole systematic review issue at the moment. Okay. So people, before I continue, maybe Ingrid, can you just maybe please confirm with me, is everybody seeing my screen? Have I shared this?
Yes, your screen is there. Yes.
Oh,
yes.
Excellent. Cool. Thank you very much. Okay, cool. So people, to start off, well, just a bit of an introduction into what are systematic reviews, and as opposed to that, of course, then what are literature reviews, scoping reviews, rapid reviews, etc., etc. So I'm sure you've all heard these terms bandied around. Let's go into more specifically what they are. So starting with a literature review. A literature review is a critical summary of existing research that a researcher is using to support a particular thesis, and they're using that to contextualize their research, and they are writing that up into a narrative review of to contextualize where they are at that particular time in their research. A systematic review, on the other hand, attempts to appraise all the literature in a particular and quite specific question. So the researcher is looking at everything that has been done in that particular area and using a very strict methodology in each step of that process. And it's in order to answer a very specific question. And a systematic review, because of its methodology and its strictness, its rigor, supports evidence-based research. So we're looking at an evidence-based solution to a particular problem. And it uses quantitative methods to compare and evaluate primary studies. So it uses a meta-analysis. Okay, so if we scroll down and we carry on and we look at three other means. So we're looking at scoping review. A scoping review is often done to as a precursor to a systematic review. It looks at a broader question than a systematic review, and what it is doing is it's mapping a particular area of research to see where there are potential gaps for where you may then move on to do a systematic review. We're finding that's happening quite a bit at health sciences, in that researchers are first doing that in order to see where their gaps are before they carry on and do their systematic review. A rapid review, yes, rapid reviews have come into the spotlight quite recently, but particularly because of the whole COVID thing, because a rapid review is almost an abbreviated or speeded up, if I can call it that, systematic review. So it is an attempt where there is limited time, and of course with COVID, they're trying to get to the point where they can do a vaccine, and they need to get there quickly. So they can't spend 2 or 3 years doing a systematic review. They somehow have to speed up the process, and that is called a rapid review. So a systematic review would be done over a period of at least a year or more. A rapid review can be done over 6 months, so the time period is more abbreviated. And also there are limitations that you can add. which you wouldn't normally do with systematic review. So you don't normally look at grey literature. You can use date limiters. You can cut down on the number of databases that you search, etc., etc. So the whole process is a more abbreviated and a bit sped up. Then the third one that we put in is bibliometric analysis, and that is, of course, a librarian used means most frequently, and that is looking at citation analysis. So using the whole SciVal, Scopus, Web of Science citation analysis to look at publications to analyze. So using those statistical methods to analyze publications from a statistical point of view. All right, so those are the 5 that I wanted to cover. If we move on to the next slide, you will see that I've put in a slide here. It's a look guide from Duke University Medical Center, which I find is very, very helpful. Have a look at some stage. It is a look guide where they look at systematic reviews and types of reviews, and they define it for you, and in a tabular format, look at what is a systematic review, what is a literature review, what is a scoping review, and in a tabular format, they look at the definitions and what each of those entail. So have a look at that some stage. I find that table quite useful. All right. So the next section is our systematic review process, and how, of course, the literature review and where we fits into that and where we stand with that. May I maybe ask at this point, any questions? Ingrid, are we going to do questions now?
Okay. Yeah, there's nothing in the chat.
Nothing,
if
no.
you okay. Yeah, so you're very welcome to put questions and comments into the chat, and we will answer where they are for Gill. We will answer them as we go along. But Gill's moving on to section B.
Okay, great. Thank you, Ingrid. Thanks very much. Okay, guys, so section B. This is the systematic review process. So this first slide looks at an overview of the whole process. So if you start at the top, you'll see that you're dealing with determining the research questions. So the researcher, first of all, of course, has to think of the question that they want to be researching, and specifying that and narrowing it down and coming up with a question. Then, of course, looking at eligibility criteria and methods. So are they looking specifically at adults or children, or are they looking at research in a specific geographical area, etc., etc.? So they need to narrow that down. Thirdly, of course, you're doing your literature search. And this is, of course, where, in our experience, where we have mostly been involved to this point. So it's your search for your studies. So that's your literature review. And that is where we would become involved, and what we're going to concentrate on in the next slides. Once you've got your results of your searches, you've done your searches, you're looking at applying those eligibility criteria, so doing your screening, collecting your data and critically appraising those results that you have found. Do they match your criteria? Etc., etc. You then have to analyze and present your results, interpret them. So once you've done your meta-analysis, you come up with your interpretation of what that research is putting forward, and then, of course, you complete your structured report at the end. So that is the whole process. What I'm going to be concentrating on in the next few slides, of course, is from a librarian's point of view, the literature search part of this. So it's number 3 down there on the right in the middle. So if we go to planning the search, so for planning your particular search, or the researcher planning their particular search, of course, they've got to formulate the question. So they have to, questions fall broadly into 2 particular types of questions. You've got your quantitative questions versus your qualitative. they've got to decide, of course, and it very often depends on the area they're in, whether their question is qualitative or quantitative. Quantitative would be a more experimental, clinical, scientific question that deals with statistics. And of course, your qualitative is a slightly more a discursive narrative question. The question for systematic review needs to be, we find, needs to be as narrow and specific as possible. So not broad, you need to go as narrow as you can to answer a very specific question. You're looking at, of course, identifying appropriate keywords and subject headings. That's very important. And of course, that's where we come in, and we're going to get into that a bit later. Looking at, of course, your inclusion, your exclusion criteria, ages, date ranges, countries, etc., etc. Identifying study types. So are you looking at RCTs? Are you looking at case studies? Are you looking at cohort studies? What specifically are you looking at? Further, planning your search. Of course, you need to see if there are other systematic reviews that have already been published on your topic or near your topic. Are there other systematic reviews that are similar, but that can help, that you can include and help you in that regard? You need to, of course, identify your appropriate databases. And then you need to conduct a constructive, comprehensive, well-documented literature research, which very importantly, and there comes in the documentation, that can be replicated. So other people need to be able to check up on that particular search and redo it. All right, so with regards to your research question, there are various tools for helping you unpack that question and asking within your question, what are the main aspects? If you look at a question and it says investigate, etc., etc., you need to be able to pull out from that question your most important aspects or your core aspects of that particular question. So the PICO research formulation tool is one way of doing this, and it helps you in that regard by looking at this acronym. It's the PICO acronym. I'm sure you've all heard of it. It's PICO. Sometimes people put a TS, PICOTS, at the end of it. And PICOTS is mostly of use. You can use it with both quantitative and qualitative studies, but it's specifically sort of aimed at quantitative research. And it allows you to ask the question, what is your population? So from your research question, you ask, what is your population? Who are you dealing with? You ask, what is your intervention? So are you looking at is it a new drug you're looking at? Is it a new therapy, et cetera, et cetera? Do you have a comparison set? And this is where the quantitative comes in. With quantitative queries, you very often do have a comparison set. So you're looking at clinical or experimental research, and you may be looking at two sets of clinical trials, or two sets of groups in a clinical trial. So you're looking at one drug versus another, or you're looking at a drug versus a placebo group. So you need to see what is your comparison set. Your drug would be your intervention, and your comparison would be your placebo set, for example, or an existing drug. And then, of course, your outcome is, what are you wanting to get out of the research? Are you wanting to see if insulin levels have dropped, if glucose levels have dropped, if heart rate has dropped, et cetera, et cetera. Also, you're looking at time frame. You could ask yourself, do you have a time frame? You don't always, but you might have. And do you have a study type? So are you looking at case studies, RCTs, et cetera, et cetera. So that's, PICO is mostly quantitative. You can also, of course, be looking at qualitative questions. And this slide gives you some idea. When you're looking at qualitative questions, you very often are asking, what are perceptions on a particular issue, or what are attitudes or beliefs? Are there barriers and facilitators to a particular issue? Those very often, that is how qualitative questions are asked. So you need to look out for those particular words. So, for qualitative questions, PICO, yes, you can use PICO, but very often with qualitative questions, there is no comparison set. So the pie chart is often used with qualitative questions because you can see in here that the other issues are here, except the comparison is left out. So once again, you're asking yourself, what is your population? In this particular issue, you're looking at patients maybe undergoing dialysis. What is your issue? What is the knowledge, those patients' knowledge of dialysis? And the effect or the evaluation is, how does their knowledge of dialysis have an influence on their experiences of the experience of having dialysis. And very often you can put in an S as well, study type, if that is relevant in this as well. So once again, you can look to see, are you looking at observational studies, case studies, narrative studies, etc., etc. So within the whole literature searching issue and the question, etc., just put the slide in just to alert you to something, of course, which I'm sure we're all familiar with. And that is, of course, that you must realize when you're searching that databases are by no means perfect. They often have some kind of flawed indexing system of some kind. So you must remember, if you're not getting everything, it's not necessarily because of your search. There can also be indexing issues with regards to databases. In this regard, just to point out an example of it is that on PubMed, the latest 6 months of articles that are inserted into PubMed very often don't have mesh headings yet. They don't have subject headings yet. So they're indexed according to keyword, but there are no mesh headings yet. So you have to consider that with regards to your particular search. Right, some other aspects of search strategy just to keep in mind. Of course, with a search, you want to be accurate and comprehensive. But in that, of course, if you consider that, you are looking at specificity versus sensitivity. With specificity, you're looking at honing in on very specific articles, and you're tending to go narrower. With sensitivity, you're wanting to make sure that you are not excluding articles, so you're wanting to go broader, and you've got to get a balance between those two things, between your narrow and between your broad, and that is what the specificity versus the sensitivity refers to. Okay, search tips. Just a few search tips, that things that come up with us constantly. Document your searches thoroughly. Each database, or most of them, have got an ability, and we'll look just now on PubMed, to sign in and to create a login so that you can save search strategies or histories. Do that. We find that happens a lot. People neglecting to document things correctly can cause lots of problems. So you need to point out to your researchers, document everything. Brainstorm. Brainstorm alternative terms. This is so important. Planning your search. When you're looking at a search question, pull out those search terms and ask yourself, what are alternative terms? Investigate, research, look at other articles and see what other terms are there. And then, of course, you need to perform your search. You need to put your search together. You need to conduct it using your Boolean operators of and, or not. And we will see that in my PubMed search, where I'll demonstrate that to give you a better idea. Right, you also need to ask yourself, with regards to your search filters, are you looking at specific publication types? Or, is that relevant? Are you looking at RCTs? Are you looking at observational studies, etc., etc., etc.? Are you looking at age groups, gender, language, publication date, etc., etc.? Right, so doing a PubMed search, this is where...
Okay, I'm Gill. Sorry, I'm going to just come in here. There are a couple of questions before we start living dangerously on a PubMed search, on a live PubMed search. So from Teresa, there's a question to say, Gill, can you say that reliability of results can be affected or questioned if using rapid review in research, given the limitations of time?
Oh heavens! Look, I'm no expert on it, but I mean, my opinion and what we've sort of experienced so far, because we've been a part of a few reviews since the beginning of the year with this whole COVID thing, and just from a logic point of view, and I mean, I'm speaking as a librarian, not as a researcher. Logically, from my point of view, I would say that yes, obviously there is a possibility of not picking up things because you are not doing absolutely everything that you would have been doing with a systematic review. Like you're not looking at grey literature. You can also be cutting down on your number of databases. So that's my opinion, but I don't know what other people would think, but I would think you do run that risk, yes.
Yeah, I would
you, Ingrid?
agree.
Yeah.
I would agree. But there again, it's a discussion that the researcher
Yeah.
or the student
Yes.
has with
Yes.
the
Yes.
supervisor.
Absolutely.
I
Absolutely.
mean, part of it, as Gill has said, a systematic review can take a year, 2 years to do. With this,
Yeah.
this is with the students doing a systematic review for a master's, and particularly in this time, it's limited. You know, you can't always apply what is in the big research teams when doing a systematic review that way. But yeah.
Yeah.
And then there's a question, there's a comment from there's something from
Yeah.
Susie who's
Yes.
asking, would
Yes.
you elaborate more on the use of bibliometric analysis from a statistical point of view?
Oh,
That's
okay.
quite a complicated question, Susie.
Sure. Yes. I'm not sure. From which, yes. Susie, maybe you could give us some idea, because I'm not sure where we would start on that. I mean, that would be looking at, and Ingrid, maybe your input here as well. I mean, that would be the way I understand bibliometric analysis, and with other colleagues who've got more experience in it than me. So it would be a case of looking at articles and looking at the site count and building up a idea of what has been published and what is out there, and evaluation of articles that are out there according to site count and journal impact factors to see what articles have been cited more highly, etc., etc. I don't know if that helps at all. Ingrid, do you want to?
I don't have really very much more to add to that. I have my experience with doing systematic reviews has been around the social sciences, psychology, and that. There's a third comment that's come up, and yes, and I guess this is pretty true with reference to the paused Oxford University vaccine trials. Would you say that this is sorry, the questions are coming, the comments are coming. Would you say that this is one of the pitfalls associated with rapid review?
Yes.
Yes. I actually attended a webinar the other day, in fact, from the health sciences faculty, where someone was talking about the sort of the rapid research coming out, and saying that there actually were problems when and questioning the results. So in particular with the things with COVID. Susie, I'm going to just answer. Susie's just asked, will that number of citations affect the reliability of research?
I'm not sure. Look, bibliometric analysis to me is one way of doing it, but it's not review. That is a way of looking at articles the way I understand from a librarian's point of view. Systematic review is Ingrid, to my knowledge, maybe the bibliometric analysis would come in more from a qualitative point of view. I'm not sure, but it's not something that we find is normally dealt with and used, from our point of view. So I can't really comment on that. Ingrid, have you got any?
No, I don't have an opinion either way. Right, let's get on to the next section. I'm of the presentation.
Okay, yes. Indeed, let's try and live dangerously. People, I'm going to do Hang on one moment, sorry, bear with me a moment so I can just get my, indeed, okay. So people, we're going to do a couple more slides and then I'm going to go out of here and then bear with me. I'm going to go into the net and see if we can get onto PubMed. But before we do that, with regards to the whole searching and databases issue, what I normally do, but coming at it from a health sciences point of view, what I normally do is I normally start such a search when I'm helping somebody. I normally start such a search with PubMed, which is why I'm going to do PubMed today. I find that PubMed is a very good database for unpacking your terms, for looking for alternative terms, and for building a search, for starting to get a good idea of where you are with terms. And then one would, of course, from PubMed, one would take your search out to the other databases that are relevant to your search. And I often get asked this question. There's no set, well, there are guidelines to, of course, to the databases that you should be covering when you're doing a good comprehensive search for systematic review. And those are PubMed, Scopus, Cochrane, and the Web of Science. So you've got your good broad subject general databases, but of course you must keep in mind that you might have a particular subject that requires a database which is more subject specific. So if you're dealing with a subject that has got a foot in psychology, then of course you need to include with your main databases like your PubMed and your Scopus and your Cochrane and your Science, you need to include things like PsycInfo because that covers psychology. If you are dealing with occupational therapy, for argument's sake, then you need to include the SINAL database because that includes nursing and the allied health literatures. If you are looking for a subject which is very rooted in Africa, context-wise, Africa or South Africa, then you need to include the Africa-wide database to make sure that you're getting everything that has been published locally. So your search question is going to determine which databases you use and cover. So while there is a guideline and there are certain databases, yes, which you should use, those are not necessarily set in stone and you need to evaluate each one according to your particular topic. So very briefly, just some background to PubMed. It is, if you think of PubMed and Medline, those two terms get used sort of interchangeably, but PubMed is the free, includes the free version of Medline, plus a few other databases like PubMed Central, open access things that are included make up the PubMed database. Medline, of course, is that specific database, which is then the subscriber version. So that is what Medline consists of. And if we are going to be looking at particular topic, so I'm hypothetically for this session looking at a particular research question from our systematic review. And so keep in mind this is hypothetical for this session. So I was looking at, if a researcher comes to you and they say to you, we're looking at an investigation of the use of psychotropic drugs to manage bipolar disorder during pregnancy. So if they give you that and they say, okay, what do I do now? So two things you need to consider when they've given you that. First of all, you need to think and to, of course, guide them in the whole issue of terms, so subject terms. You need to unpack, remember I was talking about unpacking your particular search statement and asking yourself what are the major aspects of your particular question. Well, you need to then ask them and ask yourself, what are the major issues of that in that particular search question? So if you pull that out, you're looking at bipolar disorder, and then you need to consider what are the alternative terms of bipolar disorder, okay? You're looking at pregnancy and its alternative terms. You're looking at psychotropic drugs and its alternative terms. And then also, you might be looking at a particular geographic area. So you might be looking at what is that the investigation of this particular topic and what is its occurrence in Africa or South Africa or in lower middle income countries, which crops up quite a bit. So if we take that particular question, we need to unpack our terms, number one. And number two, of course, then we need to consider which databases we're going to use in the search for those particular articles. Okay, so In our search, keep in mind you need to use free language terms, or what we call keyword terms, but you also need to consider for each database, you need to consider, is there a thesaurus for that particular database, a subject thesaurus? And if there is a subject thesaurus, you need to use it to pull out the subject terms for your particular terms, and use both of those using the OR operator in your particular search. Okay, so you need to consider some databases have a thesaurus, some don't. You need to look at each one. PubMed does, so we're going to be looking at what is called the mesh database in PubMed called medical subject headings. Right, so at this point, guys, we're now going to live dangerously, and I'm going to go out of here, so bear with me. And I'm going to go into my PubMed screen. Here we go. Ingrid, maybe I could just ask you to confirm with me, please. Are you seeing PubMed?
Yes, I'm seeing your PubMed screen.
Oh, good,
Great.
excellent. Okay, thank you. Cool. Okay, so starting off with PubMed. What I'm going to do is I'm going to take our search that I've had on the previous slide, and I'm going to go through how I would approach investigating such a particular search. If somebody approaches me with such a thing, the process that I would go through, I would first go to PubMed, and the process I would go through for looking at terms, both keyword and at subject headings, and how I would do that particular search on PubMed. So, first of all, when you're going to PubMed, just a tip, please, and to point out to all your users, most databases have a login somewhere, a sign-in or a login somewhere on the database where you can log in and create an account for yourself, where you can save search profiles. Very important. Always do that. It's a help. It's an advantage. It normally comes free with the database. Do encourage them to do that because it's a way of documenting their search, and that is, as I said earlier, that's very important. So when I use PubMed, I tend not to use the basic search screen that is in front of us here, but I tend to go into advanced, and that will hopefully become clear later. So I'm going to go into advanced. There we go. I'm going to go into my screen. Using the advanced search builder allows you to build up term by term or by sets of terms your particular search, and it allows you to see more clearly your particular terms, unpack them, look at them, see what you have, put them together using Boolean operators. It's to me much more effective than using that basic search screen where you put everything all in one long line and you are then stuck with that one long line, and if you want to change it, you've got to redo everything. So I always tell people, go to the advanced search builder and work from there. Now, I don't want this to become the how to use PubMed session, if you know what I mean, because using PubMed can be a session all on its own. But I do want to point out to you that there are a couple of ways of advancing from this particular point, so that I do just want to point out to you. There's a couple of ways of doing this. You can either, so I'll start with number one. What I would normally do is I would carefully consider my terms, and I would then, into my query box below, I would be putting bipolar disorder. It's one of my options, or bipolar disorders. Okay, with PubMed, unlike many other databases, by the way, you need to consider singulars and plurals, and you need to put them in. It doesn't use truncation, and you need to consider British American spellings, etc., etc. So I put in bipolar disorder or bipolar disorders, plural, or, and then I go through my various keywords that I've thought. So I've done a bit of brainstorming, I've done a bit of literature searching, and I've tried to see what other terms crop up in this particular area. Okay, so I'm looking at mania or manic, or manic disorder, disorders, or manic depressive psychosis, or manic depressive psychoses, or keeping in mind, I did pick up in the literature that, and you've got to think of all these things, that manic depressive can be spelt as purely as two words, or it can be spelt also with a hyphen between the manic and the depressive. Okay, so you've got manic depressive psychoses. So do you see where we're going with this? Everyone following me? You've got your particular terms. You're putting them together using the OR operator because these are alternative terms for one particular set. So you're putting them all in one line, and this is one way of doing it. You can put them in all on one line, linking them with the OR and your brackets, and then over here you can put in add to history. You're not wanting to see these results right now. This is only one of your sets, so you're not interested in looking at all your 59,000 odd records. You're wanting to just get that into your search builder below so that you can manipulate it later. Just a few tips regarding this, regarding other ways of doing this. First of all, if you are dealing with terms where you are maybe not entirely sure of a particular term, you don't know if maybe or terms, you're not sure whether it's going to maybe set you off on the wrong track, if it's going to be relevant or not, and you maybe want to keep that particular term separate from your other terms too, so that you can add it in and take it out more easier than if it is all part of one particular string. So you could put in, for argument's sake, mania. You could put that in separately, or you could put in manic separately. So you want to keep that as an option to put in later with your search, and then you can take it out of your search below, your search number, your first search that you did over there, so that you can take it out and put it in easier. I always say to people, if you're unsure of things, don't put it into a string, do them separately. And if it comes to it, sometimes I get to a point where I'm doing each and every single term separately, so that I can manipulate them and take them in and out of my search as needs be and see how my results differ when I put them in. So that's another way of doing it. The last thing I want to point out to you is your first box at the top over here. You can also use this to build up your search. And also, very importantly, on the left, you'll see that there's a drop down over here. And under these, you can choose a field for that you want to limit your particular terms to. So you can see there's everything here. There's dates, there's authors, there's filters, there's grant numbers, you name it. There's mesh headings, there's at the bottom, you'll see there's text word, and there's title, and there's abstract. Now, these are popular filters, subfields to use in PubMed. For a systematic review, I wouldn't be using title, and I wouldn't be using title abstract, but on the odd occasion, depending on the search, we've had people using text word, which is slightly broader than the two down below. Okay, so that is an option. But I find for most systematic reviews, I say to people, don't use filters, just put it under all fields. And what you can do here is then build up your search using this. So you go mania, and you click on add, and you'll see that it puts mania into your box down below. Okay, if you then put in manic, and you click and together using the OR operator, and you see what it does then? It puts mania or manic. If you now put in bipolar disorder, hang on, and you click on all, you'll see that it is now building it up for you using your Boolean operators over here on the right hand side, and you can use that then to build up your search using your inbuilt operators, and then you can click on add to history and then get it into your history down below. Okay, so those are your various ways of busy building up, main ways of busy building up a PubMed search. Okay, so once you have thought of your keywords, and these aren't, by the way, for number 20, sorry, I was working on PubMed earlier, that's why it's starting at 20, so forgive me there. It's search number 20. For these over here, these aren't necessarily all of them, so just keep that in mind. I'm only putting in so many for to be time expedient for this particular session. There might be more, but I'm going to leave it at that for now. So we've got our keywords. We've thought of various keywords. What you now need to do is, once you've thought of keywords for a particular aspect, is you need to ask yourself, on the subject headings on PubMed, in other words, in the mesh database, are there one or more subject headings that would be relevant to this particular term. So is there a correct subject heading to use for bipolar disorder or mania or manic depressive psychosis? So to find that out, what you need to do is you need to scroll all the way down. You click on PubMed at the bottom to get back to your main PubMed screen. You scroll down a little bit further and you will see on the right over here it says mesh database. So what you do is you'll see it takes you through to a screen that looks like that. And what you do now is you put in what you know. So you're putting in the keywords. You don't know what the term name to main subject headings would be. You're putting in the term that you know. So we're looking at bipolar disorder. We start number 1, bipolar disorder, and we get it to search. And you will see that it takes you through to now a different looking screen. And what this is showing you is it's saying to you for bipolar disorder, these are the terms that we are suggesting that you use for that particular aspect. So these are now not records, these aren't journal articles, and they're not keywords. These are subject thesauri terms that you can use, and it always starts off with the most general one at the top and it makes its way down. Sometimes there's only one, sometimes there's 2 like we have now, sometimes you can get 6 pages of thesauri terms. For this one, it's giving us, of course, the main one, bipolar disorder. So it's telling you, you've asked for bipolar disorder and it's telling you, yes, the correct term indeed is bipolar disorder, and it's spelt in that particular fashion. The second one down is it looks like a genetic thing. So we're going to ignore that. That's got nothing to do with what we're doing with it at the moment. It gives you a definition under number 1. You can either at this stage think, yes, that's cool, I want to use that, and you tick on the box to the left and you click on add to search builder, and you will see it will put in bipolar disorder mesh into your box. You can either do that, or if you want to check further regarding that particular term, you can click on the term and it will take you into the full record for that term. And once again, it gives you a definition, gives you a year introduced. It gives you subheadings that you can put together with this particular term if it is relevant to what you're doing at that particular time. Okay, I'm not going to use that at the moment, but if you are looking at the microbiology or the nursing of bipolar disorder, you can put in, you can tick your box and you can add that to your particular term. A few other tips on the screen. Restrict to a major mesh topic. When items are indexed according to mesh, under each record, and I will show you one in a moment, you will see that some of the mesh headings are indicated with an asterisk, and those means those mesh headings indicate that that is a major topic of that particular article. So if you only want the articles where bipolar is regarded to be a major aspect of the article, you would click on restrict to a major mesh topic. If you click on do not include mesh terms found below this term in the mesh hierarchy, if you go down, if there were other aspects under bipolar disorder, if you click that box, it would only restrict your search to bipolar disorder and it would not include what would be below. At the moment, that is where it ends, but if there were, it would restrict it. One last thing I want to point out about this is, you'll see under entry terms over there, I use entry terms a lot when I'm investigating a search on PubMed. These terms over here they're giving you some idea. They are indicating to you that you need to investigate these as other keywords to be as part of your search. So these are other alternative terms that it is alerting you to in your particular search to possibly use in your search. So I often look here when I'm struggling for terms in a particular field that is new, and I'm a particular clinical thing that's new to me. I often come to mesh and I find the mesh term and I look to see what are the other terms that they suggest here, because that can be very helpful. Okay, so what I'm going to do is I've added it to my search builder and I'm going to click on search PubMed and I put it into my box. And if I go back to advanced, you will see now in my search over there, I have got keyword terms, I have got my mesh term. So what I do is on those 3 little dots over there, I click on add query and it puts my keywords into my box at the top, my search box. If I click on the 3 dots next to bipolar, next to my mesh term, I click on add this with an all, because if you look at that statement now, you're looking at either keywords over there or you're wanting to look for articles that are either indexed with keyword or with a mesh term, the subject heading of bipolar disorder. So you want one comprehensive set now of bipolar disorder that you want to add to your particular search. So I click on add to search history, and it puts one set now that I could use of bipolar disorder. So I've got my bipolar disorder sorted out. What I now need to look at is prenatal. So I'm looking at prenatal or other terms for prenatal, antenatal, or antenatal. Oh, sorry. Spelling. You see how critical spelling is? Antenatal or pregnancy or pregnant. So if you look at those terms, prenatal or antenatal or pregnancy or pregnant, and any other terms that you can think of, but those were the terms that I was looking at earlier, and those are the ones that I think probably are the most relevant at this stage. So I put that in. Just an idea to when I was saying putting terms in separately, if you're not sure something is relevant, something I thought of you could do at this stage is you could use perinatal, because you could think maybe this is relevant, the 2 weeks before birth and the 2 weeks after birth. That might be relevant. It might or might not be relevant. You could add it to your history and you can see that it'd be separate there, and you can include it and see what difference it makes, or you could just leave it out and it's not going to make a difference to your particular search. Okay, so I've got prenatal terms. If I go back to PubMed once again and I go to this main screen and I go down to mesh, and I'm now looking for prenatal, prenatal subject terms, prenatal. If I put in prenatal, what do I get? Okay, so it gives me a long list. Now you see this is now a long one. This is 3 pages, so it goes down, and what you do is you scroll through them, and it normally starts with general ones and it makes its way down. I've scrolled through these 3 pages earlier and they get more specific as they go down. So if we go down to page 2, you'll see you're getting to rather more specific things. There we go. And I did go through them and I thought there was nothing there. So I'm going back to my first page. And I thought that the one that would be probably the most relevant to our search at present is the prenatal care. There is no prenatal all on its own. It's all prenatal care or prenatal education, etc., etc. So I'm going to include prenatal care into my search because I thought that that might be relevant to where I was going. The other mesh term that I thought I'd better look for is I better put in pregnancy and see what it says about pregnancy, about terms for pregnancy. So I'm going to put in pregnancy, sorry. And you'll see that I get a list once again, and it's a long list of 6 pages of terms. Once again, I've had a look through them for the sake of expediency. I'm not going to go through all of them. They get more and more specific as you go down. It's various issues regarding pregnancy. The first one at the top is the most general one. I'm going to include that into my search. I add to Search Builder, I search PubMed, and if we see now, we go back to advanced. You've now got a set of keyword terms for prenatal, and you've got your mesh terms for prenatal, and you've got perinatal separately, so you can include that at will or not. If you decide to, you can do it on its own to see what the difference is, etc., etc. I'm going to include just prenatal for now, time expediency sake, and I'm going to click on all, and I'm going to click on all, and I'm going to get you there to have a look at the search screen. There's my keyword terms, there are my mesh headings, and they're all connected with ORs. So I'm going to add to history, and I'm going to put that into my history. So there I've got a prenatal set, and I've got a bipolar set that I can use. Okay, next set. The last thing we were looking at, of course, was psychotropic drugs. And this is where spelling becomes quite a thing. So, psychotropic drug or am I on the right track? Please yell if I'm not, spelling wise. Psychotropic drugs or psychoactive drug or psychoactive drugs or Psychoactive agents. Psychoactive agent or psychoactive agents. Or,
Yeah,
of course.
so Jill, you sort
Yes.
of colleagues, you can see it's quite, it can be quite
Yeah.
complicated.
Yeah, it can be. Sorry,
just,
yes, actually,
yeah,
I know, and maybe I'm not also. I don't want to complicate it by doing all terms, yes, because that's just going to make it more complicated. But you'll get the idea. So I'm sort of going to leave it at that. So we're looking at psychotropic drugs or drugs, active agents. Psychopharmaceutical is something that I discovered as I was doing my search. So psychopharmaceutical or psychopharmaceuticals, and I add to history. Okay, so there's my keyword search. Now, once again, this is my last one, bear with me. We're going to go down to MESH, and I'm going to put in psychotropic drugs and see what they say about psychotropic drugs. And see if they say what we should be using for psychotropic drugs. And they do say, indeed, that there's psychopharmacology as well. I wondered about that, but I left it out, and I'm going to leave it out for time expediency for now. But I put in psychotropic drugs, and if we now get back, there's the exciting part, you see, when you get to this point, you can now start building things, which is the nice part. So you've got your psychotropic drugs, once again, as keywords, and you've got your psychotropic drugs as mesh headings, and I put that as alls to get one statement for that. All right. Now I've got my psychotropic drugs and my pregnancy and my bipolar disorder all sets ready for putting together. What I now do is I choose my 3 sets. So under psychotropic drugs, I add my query and I put that into the box at the top. I go to prenatal. There's my prenatal set with my keywords and my terms, and I add that with an and, right? You're doing and now, you're not doing all, because you're wanting the combination in articles of all 3 of those those 3 concepts, sorry, not as alls, but as ands. You want all 3 of those to crop up now in all your articles. So now you have to go to using the and operator. So all 3 together using and, add to history, and you get a result of 452. So you see, you've gone down from huge sets of 392,000, 1,054,000, and 59,328. When you put them all together, you get down to a result of 452. And those would be your next thing to tell the user now. Of course, those are your results. There we go. And it's not set in stone. You might need to go back and think and redo, but that's an initial set. So you would then be saying to your user, okay, you now need to screen these articles. You need to go through them. You need to see if you're on the right track. And once you've got your terms nicely sorted in your head, you would then take that search across to your other databases and do it in exactly the same fashion. Of course, not all databases work the same, so you need to account for that, but you need to make sure that the terms you are using are effectively the same. Okay.
Gill, would you like to just show the download, the download
Yes,
bit?
indeed. Oh, absolutely. Yes, that's a good point. Yes, absolutely. So from here, you've got results. There's various ways of downloading. There's 2 things to download. So let me just go back to advanced. Under your search history, I find this hugely useful. And I do it every time I've done a PubMed search. Is at the top of my history, you see it says they download. This is for downloading your search history. I always tell researchers, when you've done with a PubMed search, the first thing you do before you lose it and it times out, you go to your history, you click on download, you open it in an Excel format, and you click on OK, and it will open your history in an Excel format for you. Very useful, because then you've got a document of your search, and you can then send that document on to your supervisor or to somebody else, a colleague, a colleague in your research team, to say, are we on the right track? So that's one way of doing it. If you go into the 452, of course, now you're dealing with your actual records, and you scroll down. Indeed, your downloading and your saving of your records occurs at the top over here. So you can Send to is very useful, of course, because that is where you send it, of course, off to a citation manager like EndNote or RefWorks or whatever. So that's a very important one. You can put records onto, of course, onto a clipboard. So if you are sifting through records at this stage and you're wanting to put records onto a clipboard, you think that one is useful. Hypothetically speaking now, sorry, I'm just going to randomly choose some articles. That's that's relevant, that's relevant. What else is relevant? Number 6 is relevant, etc., etc. There we go. You would go send to the clipboard, and you would put records on a clipboard. 5 items have been added to the clipboard. Go to the clipboards page. You will add records from each page onto your clipboard, and at the end you go into your clipboard and you send off those records, etc., etc. So you can also email records, or you can save records, of course. There we go. You can choose records that you particularly want to save, and you can save records. Ingrid, other things I should be pointing out. Of course, on the left-hand side, you've got your filters. So if you're wanting to limit by date, by type of publication, by age range, by language, etc., etc., you would use those filters on the left-hand side. Guys, questions? And Ingrid, anything else?
Okay, there's nothing in the chat. I think people, it's quite overwhelming.
Okay.
When one plays
Yes.
around with PubMed.
Yes,
But you can
yes.
see how important it is to actually know the databases and to know how the databases
This
work.
is very important.
Yeah.
Very important.
So yeah. Thank you.
Okay, cool.
So we're going to revert back to
Yes.
to the
Indeed.
slides, and the last
Bear with
section
me.
of this session,
Absolutely.
which
Bear with
is
me. There we go. Let me just get to the end there, guys.
Yeah.
Hang on a moment. And sorry, guys, bear with me a moment.
Okay, so what Gill went
Yes.
through is in fact on the
Yes.
slides as well.
Yes,
So you
there
would
are
be
slides there.
but this is the part that we're going to get to, is the role of the
Yes.
librarian. So Gill, if you could move on
Yes.
to the next slide.
Yes.
So what has happened? I mean, librarian involvement in systematic reviews is actually a recommended practice by those institutes, and Cochrane and the Joanna Briggs Institute and the Campbell collaboration. Sorry, Elizabeth, we are we're actually recording, and you will get the record. Participants will get the recording. So in fact, the recommendation is that librarians are involved. I mean, people can't do their systematic review without the library and without the librarians. Gill, next slide.
Okie dokie.
So where do we fit in? I mean, in that scheme, as Gill was saying earlier, in those stages, where do we fit in? We're actually probably part of stage 1 and stage 2. So the problem formulation, you know, with playing with the research question. I mean, not all research questions are appropriate. Systematic review process is not always appropriate. So there's part of that discussion that one has. It's the good old reference interview at. I mean, some of this is all skills that we actually do have in the systematic review. Jill, do you want to click through to the next slide?
Yes, there we go.
So what I've seen certainly is it literally is two tiers of library involvement. We need to probably differentiate between providing guidance or instruction, or participating as a collaborator. So what I've certainly seen from other libraries where they have tiered services. So tier 1 is generally a help with some of the steps in the process, choosing where to search, assisting in developing that search strategy, the and or nots, and looking at those keywords, showing the students how to run
run and record the search, managing those search results. You might have to do some training on EndNote or RefWorks. And then tier 2 is sort of really high level stuff. Active member of the research team, and you actually become a co-author. I mean, that is part of the recommendations from the various bodies, that the librarian is included as a co-author. I've also seen sort of tier 1 kind of divided, so that there is an initial consult with the student, and that would be the sort of basic run-of-the-mill things that we do. And where you've started to work on keywords and developing that search strategy and that, I've seen recommendations that the librarian is acknowledged, not a co-author, but that the librarian's input is acknowledged, which is quite interesting. But I'm going to ask Gill to sort of share what happens in her library, because they are quite involved with running the systematic reviews for quite some time, as you can see from the slide.
Thanks, Ingrid. Thank you very much. Yeah, so just to briefly give you some input where we are, but also to bring up some issues that I think is good for us to think about and to consider, and things that we actually have been talking about for a while, concerns that we have. We're talking with my colleagues, and I talk about, comes up frequently, and we talk and we thrash it out, and I think these are things that we need to consider. So first of all, yeah, about just some context, about 6 years ago, the MEd at the Department of Medicine, you used to have to do a clinical MEd or a clinical experimental MEd, and they decided to introduce a systematic review as a means of doing an MEd. And of course, at that point, at that point we became involved, because then of course the researchers came to us to assist them with the literature search. So that's where we became involved, and where we've been involved ever since. It has just spiraled to such an extent that there are just so many of them, and it's something that we've just got to a point where we get consults all the time. We have, and just to focus on a few of the issues. So where do we focus? We do indeed focus on that literature review. So helping them with the literature review, setting up their search terms, databases, how to use them correctly, training them on how to do that. We simply do not have the resources, the staff hours to do searches for people and to run it all for them. We train them how to do it, we assist them with it, we guide them. But getting involved further in the process has just not been possible at present, simply also because of time constraints, staff constraints. So what we do is they come to us, they ask, can they have such a session? We set a consult for them, but what we do is we send them a form in which they have to enumerate quite in depth what their search is. And then before they see us, we sit down and we investigate that search. Mostly I start with PubMed, and I investigate their search. And the whole process is hugely time intensive. I spend about, I suppose, about 2 hours for each one beforehand, looking at their search, unpacking their search, trying to get to grips, because we're not doctors, so we have to get to grips with jargon and that kind of thing, and seeing how best to guide them going forward. So I do that. We sit with them, and we all do that. We sit with them in an interview, and we give them some guidance. They go off. They investigate, they come back. So it's a question of the first interview, and then follow-up interviews and follow-up help. The whole issue of screening and subject knowledge, like where should we be involved? To what extent in this process should we be involved? We would love to be involved further, but as I say, we don't have first of all, the resources, but also one has to ask the question, with screening records, do we have the subject knowledge to screen records effectively? You do have to have some clinical knowledge. Yes, you can have guidelines, but do we have sufficient clinical knowledge? And I'm just throwing that out to screen records. And the other thing, my last point that I would like to make is, and I would love feedback from other people and maybe ideas of a way ahead, because what we've been discussing is with getting involved in such teams, should we not be setting practice guidelines for ourselves? So what can we provide? But also, what do we expect then from the researcher? Because we put an enormous amount of time into it. Do we get acknowledgement for the time and the effort we've put in? Also, the other thing that has cropped up fairly recently is where colleagues, and I can think of an issue last year where a colleague was in an integrated team and was down as a co-author, helped them, of course, through the question and gave extensive help into the correct way to do the search. And towards the end, the search was changed and sort of simplified for I suppose for practical reasons. And then what do? Do you agree to this, that you now put your name to something that maybe you don't entirely agree with, or that was not your original advice, etc., etc.? So there are questions that we need to ask, and there are questions that we need to consider a way ahead, and what do we do? So that's my input, Ingrid. Thank you very much. Thank you.
Okay, thank you. Does anyone have any kind of comments, or if you want to put your hand up to make a comment? Could we have the poll up? We didn't actually show the results of the poll. Anna-Marie, could you?
Ingrid, I think we're going to run the poll from start. So those people that indicated before, they just need to
Oh, okay, all right. Because part the poll was originally just to kind of get a sense of your experience level. So if you can tick that, it's just we want to get a sense. Do we do part two? Do we run some more very specific workshops, series of workshops through HELIG? Can we set up a sort of support network for ourselves? Especially now with the sort of that it's not just the health sciences field discipline that is now looking at systematic reviews. Does anyone have any kind of comments? Who's assisted with a systematic review? Perhaps has been recognized as an author, that the contribution is there. Maybe in your institution you've got a practice guideline. That this is what the services are that you offer. Any takers? Anyone want to say something? You can unmute.
Hi, Ingrid. Thank you. It's Teresa here.
Yes. Hi, Teresa.
Yes. We have not done systematic reviews, but we have been involved in annotated bibliographies in my institution. And I have also been involved, but separately, I think not as part of the annotated bibliographies, but I have been involved as a co-author in some of the research with my research team. Yes.
Okay, that's
Yeah.
yeah, that's good. Okay. All right,
Okay.
so there, thank you. There's the poll results. So quite a number of us have not really, 57% of us have not really done one formally. Yeah, and I think that's for most of us. It is something new. It takes our skills as the librarian. I mean, you know, that basic reference interview, knowing the databases. I think that is quite important, to know the databases, to know the how to use the thesaurus, all those bells and whistles on the databases, and to end note, I think, quite well, that, you know, where you can possibly manipulate how and to show the researcher, or show the student how to manipulate the results. Gill, you've done that as well, have you not?
Yes, you mean from an EndNote point of view? Yes.
From an EndNote point of view.
Sorry, I should have mentioned that's also what we help with. You know, they do their search, and we do give help in EndNote and in showing them how to take it out and organize and that. And it is very important to have that, yes, to have a citation manager, because you're looking at huge numbers, and you have to have some form of documenting those and giving some a platform from which to work, and also to deduplicate. So yes, we do use EndNote.
Okay, and then I must just say, from my own point of view, I've been using the systematic review process, that process of searching that Gill showed, those individual searches. I've been showing when I've done consults, just when people have been coming in and asking for assistance with to gather literature on a topic. It's never mind that that they're not actually looking at a systematic review. That process is actually quite a systematic process to use to gather literature. So
Absolutely, yes.
Yeah. So
yeah.
I've been doing that. So even if one isn't doing a systematic review per se, there are tools from here and strategies from the systematic review process that we can actually use in our other dealings, in our other assistance with students.
Absolutely, it's a process we would do anyway, really, you know.
Yeah. Okay, there are no comments or anything like that further. Gill, do you want to move to the next slide? We are just about at the end.
Yes.
Okay.
Yes, indeed. Oh, yes, this is just indeed, I wanted to mention to you as part of my input that this is on our page. We've got two guides, LibGuides, which you're very welcome to look at, that have tabs on how to approach a systematic review, and resources for systematic reviews, and analysis tools, and critical appraisal tools, and that kind of thing. So please have a look at our LibGuides on our page, and the Evidence-Based Medicine Library Guide and the Postgraduate Research and Health Sciences Library Guide both have input on systematic review. And I think, Ingrid, that...
okay, yeah.
There we go.
Yes. That's what our students and researchers, we need, you know, when they say, but I have to do a systematic review, and I mean, particularly the students, because they often are not very clear about what it is.
Yes.
All right. I think that brings us to the end. The next slide has got some references on it, and these slides will be shared. Thank you very much. This has been a systematic review introduction.
Thank you very much, everybody.
Thank you.
Attending. Thank you. Thank you.
Yeah.
Thank you.
Okay.
Thanks, guys. Thank you.
Okay. And we shall Okay, and then as you can see, it'll be on the LIASA YouTube channel shortly. But thank you everyone for attending.
Thank you, people. Thank you very much. And,
Yeah.
and good luck with all that. Yeah.
And if you give some, if you know, sort of, okay, I'm just seeing, wait for more engagement on SRs. Perhaps that might be something that we can consider setting up as communities of practice on LIASA for along with the communities of practice for Wikipedia and for information literacy, that perhaps we can actually set up a COP for there, which would be a support for each of us. That is something that we could consider. We'll talk to the HELIG national team. Or
Okay, thanks, Ingrid. Thank you very much. I will also organize sending that PowerPoint to Anna Marie. So I will do that in a moment.
Okay, so what guys will get, what there will be is the PowerPoint with the section C back up, the plan B, plan in case we we couldn't go online, had online issues, but the slides will also be made available separately.
Great, thank you. Thanks, Ingrid. Thank you for all your organization. Thank you.
Thank you, Jill.
Thank you. All righty. Thank you. Thanks very much, everybody. Okay.
Okay.
Thanks, everybody.
Bye-bye
Bye.
then. Bye-bye, everybody. Bye-bye.
Bye.